Awesome. Well, we'll get started. First off, hi everyone. I'm Anna Marquise. I'm the Civic Engagement Coordinator for the Equality State Policy Center. And welcome to the People's Review Live, hosted by us, ESPC. We are a nonpartisan, nonprofit organization working to improve the lives of all Wyoming's people through transparent government, fair elections, and thriving communities. The People's Review Live is designed to help people all across Wyoming engage with our government and keep up with important issues and debates. When we work together, we can ensure transparent government, fair elections, and thriving communities. And that's never been more important than it is right now. Our first People's Review Live was a huge success, and we're super excited to follow it up with this awesome panel. I'm now going to hand it off to our own executive director, which is Chris Merrill, and he's going to introduce us to our panelists and go over tonight's topic.
Thanks, Anna, and hi and welcome to everybody. We're excited to get started, but before we do, just a little housekeeping here. Most people are probably pretty used to Zoom these days, but because we're going to have a lot of people tuning in, when you're joining by watching from home, you're going to be muted. Everyone's muted. We had about 80 people register to join tonight, so should be good discussion and conversation. So if you want to participate, you would use the chat function, and the chat is also where we're going to drop any resources that we might mention or that are available to us and are pertinent to the conversation. So please feel free to ask questions, join in the conversation in the chat if you'd like. And we will try to get to as many as we can of the questions and comments as we go along. And I will introduce the panel momentarily. But before I do, I thought it'd be good to try to present the context of this conversation we're having today. Now, the folks on this panel are the experts, but I'm going to try to give my layperson's explanation for the context of this conversation. So the sandbox within which we have to play right now is the Affordable Care Act. It's the law of the land. And when the Affordable Care Act was enacted in 2010, it required that all states expand health insurance coverage to people earning up to 138% of the federal poverty level. A subsequent Supreme Court decision made that requirement an option. So states had the choice to opt in or opt out of this Medicaid expansion piece of the Affordable Care Act. And the point of it, the design idea behind expanding this Medicaid coverage to people up to 138% of the poverty level, which is, if you're a single person, it's about $16,000. You're making about $16,000 a year if you're at 138%. The point is to close the coverage gap that happens if you don't expand this population, where you have a situation like you have in Wyoming and the 13 other states that have not expanded, where you have a group who are covered under Medicaid, and then when they start earning a little more, they lose coverage. They don't make enough to purchase subsidized health insurance on the health insurance exchange, and they make too much to get Medicaid. And so the idea is you close that gap down, and it makes for a smooth transition into the private marketplace. So as you earn a little more, you're on traditional Medicaid, you earn a little more, you move into the expansion population, you earn a little more than 138% of the poverty level, then you can move on to the health insurance exchange or marketplace, that's healthcare.gov, and you can purchase insurance there at a subsidized rate. And so that's the concept behind the expansion, and that's the context within which we're having this conversation. What we'd like to try to do today is get away from this overly reductive framing of for or against expansion, which may not always serve the people of Wyoming well, and instead try to talk about what's at stake, why hospitals are interested, why the Wyoming Education Association is interested, why medical professionals are interested in Medicaid expansion, and present that context for you all at home. And so I would like to now introduce my the panelists for today. And I will say who you are, and then I will ask you all to introduce yourselves. So starting with Josh Hannes with the Wyoming Hospital Association, if you wouldn't mind just saying a few words about who you are.
Sure. So I'm, like Chris said, I'm Josh Hannes. I'm the Vice President of the Wyoming Hospital Association. Prior to that, I worked at Cheyenne Regional Medical Center here in Cheyenne in their Population Health Division. And we've been, hospital associations and our individual members have been on this issue for the last 7, 8, 9 years when the ACA passed and Medicaid expansion was on the table.
Great. And our next panelist is Dr. Tracey Haas. You are with the WWAMI program, among other things. What's the WWAMI program, and who are you, and what do you do here in Wyoming?
Yeah, so I'm a family physician by training. Been a family doc now for 15 years. I practiced 12 years in Austin, Texas, and then moved to Colorado, where I was the chief medical officer for regional Medicaid in the greater Colorado Springs area for 2 years. And then I've been in Wyoming now, practicing in Laramie for about 1.5 years, and I'm a clinical professor at the WWAMI program, which is part of University of Washington School of Medicine's regional Wyoming branch of their medical school, to simplify. So we take students who are from Wyoming. We have 20 students per year. The program's been going on now for, oh gosh, I'm gonna get the number wrong, but several years now. And it has a great track record for retaining docs who go through the program. We have about a 70% retention rate of students who go through the program and then come back and practice in Wyoming. So that is me in a nutshell.
Thank you. And we have Sheila Bush, the Executive Director of the Wyoming Medical Society.
Hi. Yeah, so I'm Sheila. I'm the Executive Director of the Wyoming Medical Society. I started working for the Medical Society in 2006. So been here a year or two. And Medicaid expansion has been a topic that has been at the top of our list since it started as a discussion item here in the state in a policy space. So we've been on both sides of this. We have, we represent roughly 1,100 physicians across the state. So as you might imagine, there isn't full consensus around it, but it is the policy of the Medical Society to support expansion.
Great. And we have Tate Mullen, representing the Wyoming Education Association. Hello, Tate.
How are you doing? First of all, I want to thank Chris and the Equality State Policy Center for inviting me to do this, and everybody that is participating this evening. My name is Tate Mullen. I'm the Government Relations Director for the Wyoming Education Association. Born and raised in Wyoming, 4th generation. I did a little bit of circuit travel. I graduated from the University of Wyoming with a master's in political science with a focus on youth voter participation and mobilization. I taught at Front Range Community College at a high risk for a group of high risk students. I then went on to get my second master's in public policy and public administration at CU Denver. I worked at Jefferson County, Colorado as a budget and policy analyst looking at the impacts of Tabor on the state's economy. And then out to Kansas, where I was a policy research analyst for Kansas Action for Children, where we focused on early childhood education and access to healthcare as some of our main policy issues. And then I have been at the Wyoming Education Association since December, so it has been a full circle home, and I'm happy to be here. In terms of Medicaid expansion, the Wyoming Education Association has recently joined the Healthy Wyoming Coalition, advocating to bridge the coverage gap as we recognize the intersection between insurance access to healthcare, and education. We understand the importance of investment and prioritization of bridging the coverage gap in education as imperative to sustaining the types of communities that Wyoming values.
Welcome to all of you. Thanks so much for being here. It's a great panel. I think that this is a great segue into something that we were hoping to cover, Tate. My sense is that it's perhaps not well understood amongst the general public what exactly is this nexus between access to healthcare, viable schools, a viable local healthcare system, and the viability of our small towns. You know, because we have this way of life in Wyoming where we basically have a lot of small towns and small cities with lots of space between and lots of great outdoor recreation opportunities, nature, all of these things that we all love about Wyoming. But that way of life has certain foundations to it. And so Tate, I don't know if you wouldn't mind expanding on that a little more and helping us understand that relationship from your perspective in terms of the viability of schools and the viability of local communities and how and what access to healthcare has to do with that.
Absolutely. Appreciate the question, Chris. So let me start off by saying as diverse as the state of Wyoming is in terms of our population and what our cities look like, we do come from, I believe, a set of shared values. And some of those shared values, some of the most important shared values that Wyoming citizens have are our love for open spaces and our love for small communities. I mean, like you said, these are the things that we as Wyoming citizens that we cherish. Open spaces give us recreation, whether that's for hunting, fishing, backpacking, or whether it's for agriculture or for tourism. The small communities we cherish because we cherish those personal connections. You know, my time in Casper, in Laramie, in Cheyenne, you want to be able to go into your favorite restaurant, your favorite bar, your favorite, your hairstylist. You want to know these people. You have a personal connection with them. That is a great attribute. And that's something that we all cherish. Now, these shared values translate into a shared interest and a interest in sustaining the things that we value. So how do we do that? We need to recognize what are the foundations for those things that we value. The foundations of our small communities, in fact, are the very foundations for every community, and those are schools and those are our healthcare facilities. And I'll expand on that a little bit. So we need to act in the best interest of these communities and invest in schools, and we need to invest in healthcare facilities and in healthcare in general. So why are schools and healthcare facilities the foundations of these communities and all communities? Because schools and healthcare facilities in small communities employ a lot of people. This is a large employment base for these small communities. In terms of education, there's community enrichment through extracurricular activities such as arts and education programs. They are the training grounds for the future entrepreneurs, the future leaders of the state, employers, employees. And in terms of healthcare facilities, aside from employing a lot of people, they keep our populations healthy and thriving. One of the things that has always been difficult for me is that businesses or organizations' value of interest in terms of what is their greatest asset. Is it the thing you produce? Is it the service that you provide? When the reality is that the greatest asset is the employee that they have. They would not be able to provide that service. They would not be able to produce that product or sell that product if it was not for a healthy and viable workforce. So we need to maintain and ensure a healthy, viable workforce, including educators, by providing access to health insurance and healthcare. So healthy populations translate into workers who miss less work. It also translates into students who miss less school. There's a direct correlation between students missing a lot of school and their academic performance. On the flip side of that as well, when you have anybody who has kids knows that when they're sick, you have to miss work to take care of those kids. So the link between education and healthcare is that these are the foundational components of any community. And what we can see and what we have seen time and time again, my time in Kansas, my time here in Wyoming, is that you almost see an order of crumbling in these smaller communities that lose their access to healthcare, lose their access to health insurance. These healthcare facilities are the first to go. Then the next thing that you see are schools. And when these small communities lose these two foundational pieces, those towns like Deaver, Wyoming, Franny, Wyoming, Pittsburgh, Kansas, Horton, Kansas, Bouchon, Kansas, Winford, South Dakota, you see a ton of these communities across the United States crumble. So again, it is the importance that we need to invest in these foundational pieces that not only employ a large number of people in these small communities, but it keeps them going and keeps them thriving. It's not saying that we're not looking to transform any community in the state of Wyoming into the next Denver or the next Fort Collins. We're wanting to maintain the communities that we have, and investment in education and in healthcare is the best way to do that.
Thanks, Tate. That's great, and I think that's something that sometimes can get lost in the shuffle when we're having this conversation about Medicaid expansion. Dr. Haas, this past school year, there were a bunch of WWAMI students, a bunch of medical school students, also nursing students who organized and rallied around this, closing the coverage gap, and went and testified at legislative committee meetings and just were really passionate about this issue. Can you try to help the folks who are tuning in at home understand where those medical school students are coming from on this and what closing the coverage gap means to them?
Sure. So yeah, we've got a pretty socially conscious group of students, not just this year, but in previous years. It was just this year that they got to rally kind of real time around Medicaid expansion when it was, an issue that they got to testify on behalf of. But I would say, most of our students are very conscious of either themselves having been in a position of being a recipient or should have been a recipient for some sort of assistance at a certain point in their life, whether it was a parent losing a job or them having a health crisis that needed some additional assistance. And several students kind of have gotten behind it. Also based on what they've seen in clinics as they're out doing rotations, they see many patients that are falling through the cracks because they can't afford medication that should be pretty affordable, insulin, for example, or simple medications for diabetes, and then they end up losing a limb, they end up in the hospital with a very expensive hospital stay. So they're seeing this issue as something that's could be fixable, and they very much want to get behind. And they're really taking a voice to that. So I see more and more of that with our incoming class. This year, we're seeing a larger percentage of students who are making that a priority on what they choose to go into. So many of them are choosing primary care as the specialty they want to go into, and they're looking at where they'll practice. And if they're looking at a large percentage of patients who are not going to be able to pay for insulin because they don't have any assistance, it's a very frustrating way to practice medicine. It's definitely an unfair thing to think that our new physicians are going to come out and just eat those costs, or that they need to be constantly fundraising on behalf of a larger and larger percentage of their patients who just can't afford basic medications. And we're talking about outpatient, but certainly there's a large inpatient expense to that population of patients as well.
Great, thank you for that. Sheila Bush, if you could tell us, what does closing the coverage gap mean to the Wyoming Medical Society? Why has this been something that the Wyoming Medical Society has advocated for so long? And what can you help us understand from the perspective of providers what the interest here is?
Yeah, absolutely. I'll do my best. So for the physicians who are in support of expanding Medicaid, and for the Medical Society, it really is about getting the best care to people at the right time. And Medicaid makes that an opportunity that's a reality for folks. We have a system right now that doesn't function in a very healthy way, in that people have to prolong care because they can't afford maybe the preventive services. And so they wait until something is really urgent, or they're in so much pain they can't ignore it anymore. And so then their first interface with our system is an urgent care or an emergency room, which really is the most expensive way to interface with our healthcare system. And so for us, it's multifaceted, but really from the patient perspective, and as our physicians taking care of those patients, they'd like to form that relationship early, when they can identify problems early, when they can establish the relationship, build the trust, create that space in which a patient and a physician can navigate sort of the healthcare space together before anything is really serious, because it will in the long run save everyone money and certainly save lives. I think, you know, another perspective for the medical society is just predictability in the environment, right? When you know how many patients you have and who's covered by which payer, if that's how you want to kind of qualify it, but at least they know what's out there and they can make decisions within their own clinical practices about that patient volume. As it is now, you know, if estimates are accurate, anywhere between 17 and 20,000 people are just sort of hanging in the wind, waiting for that one illness or for that trauma that then thrusts them into a healthcare system. And it's just, it's not a good way to move forward. And so for physicians, it's really about the care for the patients and them interfacing with the healthcare system as early as possible and getting the right care at the right time. And Medicaid makes that an opportunity.
Now that really tees up the question I had for Josh with the Wyoming Hospital Association. It tees that up really well. And so, Josh, you know, the title of this People's Review is health insurance closing the coverage gap and halting the collapse of rural hospitals. Now, this is not some sort of hypothetical threat, you know, especially in the wake of COVID-19, that just our hospitals have been hammered. And I'd just like you to take a moment, if you could, to just kind of explain what you see as the connection between health coverage, closing the coverage gap, and the health of our rural hospitals, if you wouldn't mind.
Sure, and I would start by echoing the previous speakers about the health of people, right? So nobody would argue that having health insurance coverage is a critical way that you gain access to get care in the right place at the right time, like Sheila so well stated. And Medicaid coverage is health insurance. It gives you the opportunity to deal with issues at the right time and really be a healthy part of the community. In terms of just how it impacts hospitals, is right now across the state of Wyoming, year after year, hospitals in Wyoming provide north of $100 million in uncompensated care at cost, right? So the gap between what it actually costs us to provide care and then what we're reimbursed on that. And a big portion of that is folks who don't have health insurance coverage and show up in our hospitals in the emergency room, like Sheila said, which is just not the appropriate place for primary care when they can be receiving that in another setting that's more appropriate. Tate touched on having vibrant hospitals and strong hospitals as part of a community and the way that you strengthen your community. And I think he's absolutely right. We are large employers. But right now, Wyoming hospitals in many areas operate on very thin margins, and that's pre-COVID. So when you're talking about maybe breaking even, likely losing money, maybe having a very thin margin, you're not investing in things like recruiting physicians that Tracey is helping to train right now. You're not getting specialties into communities that might very well be needed. You're not investing in your physical plant. If you're not making money and your electric generators go out, your HVAC air handling units go out, how do you find the dollars to invest in those things so that you have the ability to provide the services that your community needs? These are all things that are a part of keeping our communities strong and thriving. And it puts the healthcare system in general in a precarious position when you're doing $100 million of care with no reimbursement. It's not a sustainable position.
So I'm going to take a moment to look at a couple questions that have come up in the chat, and hoping panelists can help answer if need be here. So one question comes from Hollis Hackman. Hello, Hollis. Good to see you. And see your name at least. He's asking, how does an organization join the Healthy Wyoming Coalition? You can just send me an email or call me, Hollis. I am cmerrill@equalitystate.org. That's cmerrill@equalitystate.org. And we, the more the merrier. We love people joining the coalition. Who is Healthy Wyoming? Maybe we didn't even cover that. It's really a broad coalition of lots of different groups and individuals, including the Wyoming Hospital Association, the Wyoming Medical Society, the Wyoming Primary Care Association, Wyoming Education Association, my organization, the Equality State Policy Center, and many others that have come together to advocate this specific issue because we feel like it would be in the best interest of Wyoming and the people of Wyoming and in our local communities. So that's who we are. Question from Marjane Ambler. Sorry if I didn't pronounce that right. We were told to contact our healthcare provider if we have COVID symptoms, but how many people in Wyoming lack a healthcare provider? Sheila used a figure, but I didn't catch it. So, question panelists, how many people in Wyoming lack a healthcare provider?
So the number that I gave was the estimate that a contracted group did in a study for the state, and the number they came up with was roughly 17 to 20,000 people would be captured if the state expanded Medicaid. I'm not sure that that's the same answer as how many people are not covered. But as it relates to the number that we do have in terms of who we think would be covered or who would be captured in an expanded space, we think it's between 17 and 20,000 people.
And this is a good time, I think, maybe to talk about who we're talking about. Who is this? Who makes up this population, the expansion population? And again, I'll give a shot at giving my layperson explanation here, but I would love to hear from other panelists. You know, if you're working, but your employer does not offer you health insurance, like we all know people. I do. I mean, I'm sure we all know people who are in this position where they're working, but they don't get health insurance through their job. Maybe you're cobbling together full-time hours in a few different jobs, none of which offer health insurance. Maybe you're an independent contractor, and you're in this certain income group. Then you would have access to Medicaid, expanded Medicaid, and until you earn more than that 138% of the federal poverty level. So panelists, do I have that right? And can you expand at all if you'd like? Yeah, go ahead, Tate.
I would like to expand on that, but I think you're absolutely right in that. And I think that this is definitely part of the discussion in terms of how many people are going to gain access to health insurance and health care through Medicaid expansion or bridging this coverage gap. But I think that there's also another important piece of this puzzle that discusses the access to healthcare in rural communities and what bridging that coverage gap through Medicaid expansion would do for the viability of healthcare facilities in those rural communities. So on one hand, you are talking about how many people are going to gain access to health insurance and healthcare through expanding Medicaid. But at the same time, I think it's important to not lose the focus of you also have people who do have good jobs, but because of where they're located in rural communities without adequate healthcare facilities, that expansion of Medicaid does in fact help those healthcare facilities remain viable within those smaller communities. So it does provide an even bigger access to a larger group, just aside from those who maybe don't make enough money to afford their own insurance.
Okay, and I'm going to move on to another question here. The great question from Dustin Blyzeffer in the chat. Dustin, for those who don't know, is a longtime journalist in Wyoming. He also, I'm also privileged to call him a friend, but I will read his question. How much does healthcare in Wyoming depend on local and state revenues? And what's the impact of the downturn in coal and oil? How do communities sustain healthcare today and into the future with a shrinking coal industry? Who wants to take that one on?
So, Chris, I can try to answer.
Go ahead,
So
Josh.
we So for hospitals, we do have a number that are what are known as hospital districts who do have some taxing authority. Some are county memorial hospitals that receive some funding from their counties, though interestingly, not all county memorial hospitals do get tax revenue from wherever they're located. You know, most hospitals operate on their service revenue. So patients come in, they receive a service, and there's reimbursement for that, and that is how they that's how they keep their doors open and pay their staff. Certainly, the ones that have taxing authority it's very helpful to have those, but they don't necessarily carry you throughout the year, and they do rely on the service revenue from seeing patients.
And I'll point everyone's attention to the slide that's up in front of us right now. This slide just outlines what the Department of Health predicted, you know, expectations for if Wyoming were to close the coverage gap and expand Medicaid coverage, Medicaid health insurance coverage. We're expecting around 19,000 enrollees over the course of 2 years. And it would cost $154 million to add this health insurance coverage, but 136 of that would come back to the state from the federal government. So it's the overly reductive way to say this is that it's basically a 90% match. So as a state, you put in 10% to expand this health insurance coverage, and then the federal government puts in the remaining 90%. We have another question from, I am sorry if I pronounce this name wrong, but I believe it's Dr. Lou Hockheiser in the chat. And he asks, what can we do about the fact that Wyoming is first or second in the country in cost per person for healthcare? So that's something, of course, that we hear a lot in Wyoming. And that's also something that we know is true, which is rural healthcare is expensive. And it's more expensive than a place that is densely populated and close to supply chains and all that kind of stuff. So anybody on the panel want to try to answer this very simple question? What can we do about that Wyoming's cost per person for healthcare is so expensive?
Wow, everybody's just super excited to jump in. I don't have all the answers. I can give sort of an overarching snapshot of some of the parts and pieces that contribute to the the cost of healthcare in the state. I think one thing that we talk a lot about, and Josh touched on it, is a little bit around patient out-migration and just population to support patient care. So one thing we learned a lot during our COVID time and continue to learn is in healthcare financing, your elective procedures and some of your specialty care and surgeries are what really finance the overall sort of system within healthcare. And those procedures subsidize primary care. And so when you're looking to recruit physicians or stand up healthcare systems in small towns, you need that population to receive all of those services locally, but sometimes you just simply don't have the population to support it, which leads to some kind of subsidy from the community. So a great example, if you look at Saratoga, they don't have a hospital there, but they have like a health foundation, and the community has to have a very large annual fundraiser out at Brush Creek Ranch that supports that clinic surviving, because they simply don't have the population to create the revenue to support the clinic to be solvent on its own. And so when you talk about the cost of healthcare, no matter how you peel back the onion or look at the puzzle pieces, if you're not in a densely populated area or an urban center where you have enough people to create or generate the revenue, communities in small areas have to find different ways to support that. And they have to make really hard decisions within those communities about what they need and what they want, and then how they're going to make that happen. And a lot of that depends on people staying in their local areas to receive that care. And there's a lot to peel back on that also. But that would kind of be the first tack at it. You've got all kinds of different contributing factors that lead to the ultimate cost of healthcare, but that's one of them.
Dr. Haas, do you want to add into this conversation?
Yeah, I mean, I would pile on that, whenever you have access to care and a priority on preventive healthcare and actual ability to pay for preventive healthcare, you're, there's a lot of national data out there that you're going to decrease inpatient stays and emergency visits. And so I don't know, I have never been able to dive into our Wyoming data. I'd love to. But I would imagine that it has a lot to do with preventive care and access, and probably higher rates of emergency utilization and delay of care that leads to worsening of chronic diseases. And I would like to pile on there too, just as part of this discussion, having worked in this space, in Colorado, I got to know kind of all the aspects of what happens when a state expands Medicaid, and you get funding. It's not just, and I think this is what a lot of people don't quite understand. This is not just health insurance. It's you get some funding that allows you to build a safety net around a community, and that includes. It's really got lots of spokes to it, and having kind of run a program for 180,000 Medicaid lives, I have a lot of appreciation for all the people involved in those spokes, but it helps capture, it's not just those people who qualify, it's not just those 19,000, it's an entire community, because at any given point you've got, and in Colorado, and I imagine this is true for other states as well, you've got about 15 to 20% of your population churning in and out of Medicaid. So people don't just qualify and then qualify forever. They might not qualify for Medicaid in 6 months, but then a whole new set do. And so having a network of services that include mental health services, substance use prevention and treatment, having the ability to support your outpatient physicians with care coordination services is a huge part of what Medicaid expansion dollars go towards, so that physicians can accept Medicaid patients and not take on an increased burden in dealing with social services. So the expansion kind of services that you can offer are huge. And then one element that nobody likes to think about, but I do because I'm a data geek, is that you're actually paying for data. And the ability to collect data and then analyze it and see that you are saving dollars in a system, that you're putting money into a smart way of doing it. So having the ability to kind of look at data real time and act on it, warehouse it, look at hospital data, outpatient data, all of these pieces. And that is one of those sort of invisible pieces to Medicaid expansion that I think we should all look at. Because right now, like I said, I can't dive into the Wyoming data because I'm not really sure how accessible it is. There's always a budget that you have to have in order to collect it and look at it and then act on it.
So can you give an example of the kind of data you're talking about and then how it might be used to improve the system and save costs?
Sure. So having the ability to look at clinical data and claims data and putting those together, it sounds simple, it's not, but I've done it and I like looking at those pieces, because then you can look and see, let's say I've got a patient who's kind of at risk, has been either a Medicaid patient, or let's say somebody who's constantly being hospitalized. We know that that's a very expensive patient for any payer. And if I get a trigger in a system, like whether it's an electronic medical record or a system that we're monitoring through our sort of Medicaid data collection system, I had a system that was, my care coordinators had a tickler, so that anytime one of our patients that were flagged as at risk went to the emergency department, we could call them that same day. So you could act on your data within 24 hours. We also had the ability to look back at the previous month, the previous year, and see if we were impacting high cost patients or at-risk patients. We also had the ability to define special populations that we know are very expensive in our communities, and our cities got behind working with those special populations. We're talking about people who are either homeless or at risk for homelessness. We're talking about kids who are in and out of the foster system. We're talking about high-risk pregnancies, people who are high utilizers of emergency services, and being able to impact that real time is a really valuable thing to do. And that data system is not as expensive as it sounds.
That's fascinating. Josh, it looked like you wanted to add to the conversation.
Yeah, just really quickly. And to Tracey's point about those different capabilities and things you can do, when health systems aren't bogged down by the rate of uncompensated care, they can invest in those types of capabilities. When you're not able to make ends meet as an organization, those types of things get sometimes left on the cutting room floor. But when you have the ability to reinvest money back into your communities, and our hospitals in Wyoming are your community hospitals, that every bit of margin is reinvested back into the system and communities to assist patients. And allowing for the ability to do that is how you invest in care coordination, how you build out telehealth infrastructure to reach people and provide greater access. And I think that's part of, to Tracey's point, what's missing from the conversation. And just to go a little step further, and I hope I'm not getting too off track, is that of states that have expanded Medicaid, Arkansas, Michigan, Montana, Virginia, to name a few, have seen budget savings in their state budgets, which then allows those states to invest in things like non-clinical social services, so that when you release somebody from an inpatient stay in a hospital, they're in a healthy community where they can go to heal.
Sorry, I was muted. So the slide that is in front of you right now is one talking about the economic impact of states that have expanded coverage. One thing we're talking about when we talk about Medicaid expansion is an influx of, in the case of Wyoming, it would be $136 million of federal money over the course of 2 years into our local healthcare systems. I would like to hear from you all what that means, what that looks like. Why is that important in terms of local communities and their economy? I just would love to hear what you think about that money coming from the federal government into these local communities.
I'll jump in on that, Chris. I'm going to stay in my lane in terms of the education aspect on this. So one of the things that this would allow, that influx of cash would allow, is, again, we've talked about that Medicaid expansion and bridging that coverage gap allows those who are low income individuals to afford insurance. But at the same time, there's that other discussion that in our rural communities, it also allows those healthcare facilities to remain viable and to remain intact and keep their doors open, providing services to members or citizens within those local communities. What that does in terms of education is that helps attract and retain the types of high quality educators that are associated with our education system in the state, and indeed in terms of attracting doctors to the state. But in terms of attracting high quality, high caliber educators, historically Wyoming has paid our educators better than surrounding states, even though over the past couple of years we have seen this competitive edge diminish at a pretty good rate. The need for better pay is directly related to the rural nature of our state, and I think that's one thing that a lot of people miss. When you're in these rural communities, you don't have the access to some of the entertainment that we do. In bigger communities, you don't have access to shopping. And anybody that's survived a Wyoming winter knows that those are harsh winters. So it becomes an incredibly difficult area to really incentivize people to move to. So in an ability to attract those educators, we need to incentivize them. So part of it is that monetary incentivization. The other piece of it is an essential need. So much like Maslow's hierarchy of needs, that access to affordable healthcare and to insurance is paramount. to the success of us being able to attract these high quality teachers. So without bridging that coverage gap, we lose a significant factor in incentivizing some of the best and brightest educators to come or stay in Wyoming. That struggle becomes cyclical. Graduates of our high schools, our community colleges, University of Wyoming recognize the struggles that they and their families have endured. Instead of enduring that generational struggle, many of these young Wyomingites, they opt to leave the state, contributing to what is known as brain drain in the state of Wyoming. Those young, brilliant minds leave the state, and they take with them the ingenuity and the great ideas that were fostered by Wyoming educators and Wyoming classrooms and paid for by Wyoming tax dollars to other states where those citizens reap the benefits of our investments. So you talk about being able to, what does that mean in terms of the growth and sustainability of these communities, and what does that influx of dollars mean? It means that we get to maintain an education system in the state of Wyoming that has been literally one of the best in the West and one of the best in the nation. It also means that we get to continue to provide that education that makes those kids, again, our next generation of entrepreneurs, the people that are going to lead us into the future in this state. We want them to stay here. We don't want them to leave. So we need to make sure that we are doing everything possible that keeps them and their families here, and bridging this coverage gap, and that influx of dollars is just one of those ways to accomplish that.
Dr. Haas, did you want to jump in?
No, I was just laughing because I love my students, and that's a great picture of them. I totally agree with everything Tate just said. I would just pile on from a Medicaid expansion standpoint that not only are we maintaining, jobs, and that's so important, and maintaining clinics, which I have a bench that is even more important, especially these independent primary care clinics that are just barely, hanging on. Having the ability to, get some reimbursement for those visits is huge. But there's also some job creation that comes with expansion. And I've touched on a bit of that when we're talking about mental health and substance use kind of outreach, physical health as well. But there's a whole, I had a team of 55 when I was in Colorado Springs, and most of those were lay community health workers. And I just loved this team. It was not a, highly trained team, which, kind of by nature, but they are able to go out and meet people at McDonald's, at soup kitchens, at their homes, wherever they were, sometimes homeless settings, and just the ability to have that outreach, and also give jobs to people who sometimes are also, a bit in transition in their careers. Anyways, there's that kind of opportunity that's available, and really exciting too, because that's how I think we improve healthcare in rural settings and in urban settings, and getting those hard to reach vulnerable populations, getting access to them. You don't do it by just setting up a clinic. You do it by actually going out and being with them, and seeing what their actual needs are, and meeting those needs where they're at. Anyway, sorry, I could ramble on, especially, with my students, but, my students want to do this kind of work. They want to get that in their training. But again, this is hard to bootstrap and fundraise for. It's something that I think, having an expansion program would help us do.
I might just jump in really quickly and put some numbers around what Dr. Haas just said. So the AMA, the American Medical Association, does a very regular economic impact study around just even physicians and what they bring to economies. And so when Josh mentioned, north of 100 million, is that your number right now for uncompensated care? So if you take that number and you think about if hospitals had even a portion of that back to reinvest in their communities instead of just covering, if any of that meant recruiting another physician or two, also to the predictability in the environment that expanding Medicaid would create, you would have a patient population that is interfacing in a more regular way with patient-centered medical homes and the like. So if they were able to recruit another physician, just for some perspective on what physicians do to an economy, according to the AMA, in a 2018 study, the average number, so this is Wyoming data, this isn't national. So in Wyoming, physicians create 8,547 jobs. That's an average of 9.8 jobs per physician who practice and take care of patients here in the state. The economic activity from that is $1.5 billion. So the average economic output generated by each physician is $1.8 million. And those are, like I said, those are Wyoming numbers, and I just think they're stunning. And I think that there's something that sometimes they get overlooked. So when you look at wages and benefits, $821.6 million are generated from physicians working in the state. According to the 2018 data, they did this based on 867 physicians. I think that they had, that's not licensure data, that's physicians who live in Wyoming communities and take care of Wyoming patients, either employed by hospitals here or clinics. So each physician generates about $938,000 in wages and benefits. So I think, you know, it equates to 43.8 million in state and local tax revenue. So if you want to break that down per physician, that's $50,000 per physician that's generated just in the tax revenue. So I think, you know, I think when you put the whole puzzle together and you really look at some of those numbers, expanding Medicaid puts Wyoming way ahead. But it takes, you have to invest a little to get a lot back, both with the health of our patients, the physical health, and then also the health of our economy as we look at diversifying.
And if I can pile on to what Sheila just said, if you look at the Wyoming workforce data, we are not doing a great job of retaining our physicians once they're trained. You know, we do have 2 primary care residency programs here in the state, and we rank 49th in the country for retaining our physicians after training here. We also rank 49th as percentage of female physicians, and we're also pretty far behind in the number of primary care docs that we need. So this retention idea is a pretty big one, and if you know that was how we see Medicaid in a sort of a different, or expansion in sort of a different frame. I really think retention is will have a huge economic impact when we talk about the workforce.
So I'm really appreciating this conversation, by the way. We have a couple of questions in the chat that are related to each other. And one comes from Representative Pat Sweeney. It's so great to see your name in the chat, Representative Sweeney. And thanks so much for standing up and speaking out about this topic during last session. You know, he's asking, how do we move Wyoming forward with expansion? I really appreciate all of your support this past session. We have lots more work to do to try to keep this moving. Above that question in the chat, Dustin Blyzeffer says, healthcare is political. How can Wyoming get over the political hump to Medicaid expansion? This is an interesting question to me because I guess I would rephrase it a little bit. It's become a partisan issue. And part of that is just the world we live in right now, right? Almost every policy question, almost every issue has become slotted through a partisan lens in one box or another, which I think is unfortunate. Just speaking as a nonpartisan person, I don't quite understand why this is a partisan issue, but it has become that. However, there certainly has been growing support amongst legislators from both major parties in the Wyoming legislature for Medicaid expansion. The question is, how do we get over the hump? What do we need to do to finally make this happen in Wyoming? Yeah, go ahead.
I'm so going to jump in on this one. So I think that these are absolutely related. And Chris, I really appreciate your perspective in that, you know, we're only as good as the system that we operate within. And currently in the national political dialogue and what we're seeing even here in the state of Wyoming, like, things have become so polarized that having policy discussions becomes inherently difficult, if not at a standstill. And so the reason I liked to start this conversation off with a discussion of values is I think that that's where that needs to come back to, because I think deep down that we do share those set of values and that we have a set of shared interests in moving that conversation forward, recognizing that some of the biggest myths that need dispelled is this isn't a partisan issue. We are talking about taking care of our fellow Wyoming citizens, taking care of those people that need it the most, making sure even those people that have good jobs have access to health care. in our rural communities because we value our smaller communities. So this isn't a partisan issue. This is about really practicing the values that we hold true as Wyoming citizens, making sure that our neighbors are taken care of. And I think reframing it within that discussion instead of looking at this as, you know, growth of government or whatever whatever context, really argumentative context you wanted to get into. That's how this moves forward, is what are the benefits in a data-driven approach, which I appreciate Josh, Sheila, and Tracey's approach to this. Like, that is imperative. Like, again, we need to look at the numbers, and we need to see that, yes, there is an upfront cost. And what was that? 18 million. But 18 million in the upfront cost. But at the same time, you look at the savings from the reduced use of emergency care, it pays for it in itself in a long run. So a data-driven approach and a value-laden conversation, I think, is the way that we move this thing forward.
So,
oh, Josh, I'm going to let you talk, but I'm going to say it is 5:56. And so we are 4 minutes before the end of the hour, and that's a hard stop for this, for the People's Review Live. So it's predictable for viewers. So Josh, I want you to weigh in with what you wanted to weigh in with, and then I will have one final question for you all.
sure. So first, I'd say I also want to thank Representative Sweeney for all of his good work in the legislature, and I would say ditto to everything Tate just said. And then I guess maybe offer this, is that if not Medicaid expansion, because I believe that our policymakers, like Tate said, want to take care of our neighbors and take care of Wyoming citizens. I don't think that's in dispute. But if not this, then what is the other alternative to close a coverage gap and get people access to the health care that they need? My argument would be is that Medicaid expansion is the better solution that's on the table, because you do invest upfront, but you reap the rewards of hundreds of millions of dollars coming back into our economy, creating budget savings from the state general fund, and getting people access to care while supporting your healthcare system and infrastructure across the state. That goes beyond just simply having a good hospital, but having a strong community and the benefits that go down to education and workforce and all the things that we talked about today. So if there's another solution, I think anybody on this panel would be up for having that conversation, but Medicaid expansion continues to come to the front as the better option.
Thanks, Josh. Does anybody else want to say this is your final chance to talk about something you want to talk about. We have 2 minutes left before we have to say goodbye for this evening.
Chris, can I respond to a question that I see in the chat? And it was what I kind of wanted to end on, or at least make a point of, you know, someone had asked about what's the biggest myth about Medicaid and kind of closing that gap. And I would like to say the one thing that I hear a lot as an argument is that once people are the recipients of assistance, that they are then disincentivized to work harder, they're disincentivized to seek their own health insurance. I would say that is not at all the reality of what I've seen. I think there's a lot of data out there to support that that's not how it works. And like I said, if you create a safety net system within your community, within your state, using your Medicaid expansion dollars, then your system actually helps keep people up and out of poverty. You're actually keeping them from ever dipping below that level. And so they, most recipients are actually roll out pretty quickly, and there is some great data around that. So I'd just like to dispel that myth.
Thank you, Dr. Haas. And thank you everybody for joining today. There's a lot of interest in this topic. Obviously, there were a lot of things we didn't cover today. There were questions in the chat we didn't get to. So maybe we'll do another People's Review Live on this topic down the road, maybe from a slightly different angle. There are a lot of myths that need to be dispelled, and maybe that can be the focus of one of these episodes. So really appreciate your help, everybody. We'll keep at it and look for future discussions on this topic. And Anna, I'll hand it over to you to bring us home.
Yeah, so thanks everyone for joining us for the People's Review Live. Another reminder, the Equality State Policy Center is a 501c3 nonpartisan, nonprofit Wyoming organization. We rely on charitable gifts to fund all of our work. So if you would like to give a donation, please go online to our website. I'll drop the link in the chat, equalitystate.org. Mail a check in at 419 South 5th Street, Unit 1, Laramie, Wyoming. And if you want to sponsor the series, please let us know. And once again, thanks for joining us. We hope to see you at the next one, which is going to be on July 16th. So keep it on your calendar, and we'll see you then.
Bye. Thanks.
Everyone.